Major money moving into Idaho to fight the opioid crisis. The Department of Health and Welfare will spend a vast majority of a new $4 million grant on expanding treatment for Idahoans struggling with opioid addiction. 6 on Your Side's Karen Laird joins us in studio with details in tonight's installment of Finding Hope.
Well, Don, the state has already been using money from a previous grant to expand medication-assisted treatment in Idaho, but this grant promises $4 million a year for the next 2 years, and 75% of that will help uninsured Idahoans get the treatment they need.
The feds are very clear. The goal of this money is to reduce death.
Reducing death by preventing overdoses and providing treatment to people fighting addiction. That's the main goal behind a $4 million federal grant to fight the opioid crisis in Idaho. The money will mainly help uninsured Idahoans receive treatment for addiction, including both psychosocial rehabilitation through therapy and, if wanted, medication-assisted treatment for addiction.
The additional cost of medication does make treatment of this particular disorder more expensive than, say, treatment of alcoholism or an addiction to methamphetamine.
But Anduesa says that added component of methadone or Suboxone is proven to help. With the grant, Idahoans in rural communities will have more access to take-home prescriptions of Suboxone, while more Treasure Valley residents will be able to undergo in-clinic methadone treatment.
Opiates are a bit different than other substances in the changes that they create and the physical addiction. So medication becomes a very important part of that treatment for those who opt in for medication.
Through a previous grant, MAT was covered in full for up to 3 months. Now the state can fund treatment for those patients for twice as long.
We think that'll give people who are struggling more time to get to become more stabilized and have a better chance of success at recovery.
Another goal behind the grant is to fight the stigma associated with medication-assisted treatment, since health experts, even at the federal level, say it's the best option for addicts to reach recovery.
Personally, I believe that medication-assisted treatment historically has kind of gotten a bad rap. You know, it has that, oh, you're just giving more drugs to druggies, and that truly isn't what it is. It is giving medication to people who have a disease.
So if you think you or someone you know may be qualified for that state-funded treatment, we have all the information on our website on how to get started. Just click on this story on 6onyourside.com.
All right, let's do a little math here, Karen. You said 3/4 of the funding will go to the treatment programs. What about the other $1 million a year?
So they have a couple of pilot programs lined out. One of them will be connecting overdose patients with recovery coaches while they are still in the hospital. Another one of those, or another portion of that grant, is going to be providing naloxone or Narcan, that overdose antidote, to first responders in more rural Idaho communities. That has already saved 30 overdose patients, plus a new pilot program with the Boise Police Department, and we'll tell you about that next Monday night.
That money spent.
Yep.
Gone.
Yep,
Well spent.
a lot of it divvied up.
All right, thanks, Karen.